Hello, everyone. Good morning and welcome to Saturday Zoom.
Good morning, everyone.
Good morning.
How's everybody doing? Hello, everyone. Good morning. I'm multitasking. I knew that was going to pop up there. So, all right. Yes. It is a beautiful sunny morning, which it wasn't a little while ago. It was so foggy. I got a little fog warning on my phone this morning. I'm like, well, I'm not leaving the house. I don't care how foggy it is. But that all burned off and it's really a beautiful day. And today we are going to focus on breast cancer awareness. So we're going to talk a little bit about prevention, the causes, the risks, the things that you can control and the things that you can't control. And we also have a guest speaker with us today. Sherry Albert is the owner of Thermography for Life. And if you don't know what thermography is, she's going to fill us in. I've been once. I have to schedule another one because I'm overdue. But we'll talk about the pros and cons of it and what people say, but I like it as an alternative to mammography. But it doesn't mean that you can throw off the mammogram. Anyway, we'll talk about that in a little bit. And Mary's with us, but she's off for a moment, and hopefully there'll be some other people popping in and sharing. If you are,
I'm here.
I
don't know what happened to my picture.
You hit your stop video or your, what is it called? Start video.
Start video. Yes.
There you go.
Okay.
But first, as always, we like to start with what's in your diffuser. Did you put anything in yours today, Kath?
I did. I went with the same thing I had last week with the bergamot, frankincense, and orange, because it's really grown on me. Smells great. Love it.
I did some research. I was like looking for something that would support breast cancer. And there was a lot of different ideas for different reasons. Some of it was anxiety or headaches or whatever might be connected if you have breast cancer, but I don't have breast cancer. So I just went with the heavy hitters today and did a combination of frankincense and rose. So I've got, high frequencies coming at me, and I believe healing products are, healing properties from the frankincense and the rose. But I can't say that on national TV, but we're not. So this is just Zoom, and it's between us girls.
Okay.
Mary's got, I bet she's got orange and cinnamon.
Orange and cinnamon. My favorite.
Mary loves that. Sherry, you got a diffuser going today by any chance?
Oh, I do not. And I actually gave mine to my sister, and I'm hoping that she's using it. Can you hear me?
Yep.
No.
Okay. You're a little bit lagged. You get behind, but that's okay. We will be flexible and go with this. So, all right. So October is Breast Cancer Awareness Month. So we thought we'll talk about this for a couple of weeks. So today is part 1. I have no idea what part 2 is going to be about, but more of the same. We'll find more to talk about. Anyway, I'm going to start off with talking a little bit about the causes and the risks. And then Kathy's going to talk a little bit about prevention, diet, and then we're going to talk about early detection. And Sherry can jump in with her information about thermography. So first of all, the precise causes of breast cancer are not really known. They're unclear, but we do know risk factors. And from the website that I was on, which I can't remember what it was, I think it was a WebMD, it said that even most people who are considered high risk don't get it. So it is something that goes up with age. So some of the things that you can't control about getting breast cancer. The first one is being a woman. Women get it far more often than men. But it's 100 times more likely in women. A history of breast cancer. So if somebody has had breast cancer in one breast, you are 3 to 4 times likelier to develop breast cancer in the other breast or in another part of the same breast. And it's different than a recurrence. Your age. So your risk goes up as you age. Whoops, we lost Sherry altogether. Hopefully she'll be popping back in. So if you are, let's see, in women ages 40 to 50, there's a 1 in 68 chance of developing breast cancer. From 50 to 60, it goes up to 1 in 42. 60 to 70, it's 1 in 28. And women over 70, it's 1 in 26. So I guess it's you get to live longer, but you have more chance of developing it. A direct family history. So someone in your family, your mother, sister, daughter, first degree relative with breast cancer puts you at higher risk. And your genetics, about 5 to 10% of breast cancer cases are inherited. If you have dense breasts, I unfortunately have dense breasts. So that's my second, well, I guess I'm being a woman, my age and my dense breasts, which, if you have them, because when you start getting mammograms, they have trouble. And sometimes you have to have multiple ones. And I've been there getting a mammogram where they say, okay, wait in the other room. Okay, we need to do it again. And I'm like, no. And it's because I have dense breasts. And then I had to actually have an ultrasound because of my density. Let's see, if you have breast lesions, atypical hyperplasia, I'm not even going to go there because I don't understand that one. But if you have a distant family history, so a 2nd or 3rd degree relative, such as aunts, grandmothers, and cousins, previous abnormal breast biopsy, reproductive history. So getting your period before you're 12 is a risk factor. Starting menopause after age 55 is a risk factor. Never being pregnant or getting pregnant after 35 all raise your risk of breast cancer. And if you don't breastfeed, that also increases your risk. Radiation treatments can increase your risk, other cancers in the family. And then there's this exposure to diethylstilbestrol, DES. But I don't know if that is still being used, because it says many women received this drug between 1940 and 1971 to prevent miscarriage. So not sure if they even still use that one. Now, the risk factors you can change, and Kathy's going to talk more about these, but your weight, being overweight increases your odds, especially being overweight after menopause. Drinking alcohol, and if hormone replacement therapy, long-term use of estrogen and progesterone increase the risk of breast cancer. And the risk seems to go away if you've stopped using them for 5 years or longer. So the longer you've been off of it. Being inactive. So the risk, your odds go up if you don't exercise and move. And your reproductive history. So I already talked about that one. So, and then they say factors not related to breast cancer, and I would argue some of these, but I don't have the research on it. Excuse me, using antiperspirants. I don't know. I would argue that one. They say it's not related to breast cancer, but I have used different deodorants or antiperspirants, and I've had some breast cysts that have occurred from that. And I've used frankincense to get rid of it, and hallelujah. But I think there could
Could it
be.
be, are they saying that they don't know or do know because of the fact that some of the antiperspirants and things contain aluminum, right? Is that the thing that's in there that we want to avoid?
It says nothing
some-
about it other than it's not related to breast cancer, which I don't know.
I think it depends on your ingredients in whatever you're using,
Yeah,
whether or not they can say this is related because it's linked to these chemicals or these things that are in the antiperspirant
So,
or deodorant as compared to the ones that are considered
Can you hear me?
clean.
yeah, you were out for a second. Go ahead, Sherry.
so underneath your armpits, you have pores, obviously.
Ugh.
And you have a lot of lymph glands underneath your armpits. So when you apply deodorant, either spray or paste or what have you, it does clog up those pores, which clog up the lymph glands. We want to keep those lymph glands moving. We don't want to have things that will plug them up. So that is most likely a cause of the start of something going on there. When you clog up those lymph glands, it's very important to keep those free flowing.
Great. Thank you for that. Let's see, other factors not related, wearing underwire bras. I won't wear them anyway. They're too uncomfortable, you know, sorry. The girls are going to hang where they hang. Having an abortion or a miscarriage is not related. Having fibrocystic breast changes, which is a dense breast tissue with benign cysts. So I guess that's good news for me, but
Or drink caffeine, folks, if you have that.
multiple pregnancies is not a risk factor. Coffee and caffeine, they say, is not a risk factor. What were you just saying about that, Kath?
I was diagnosed a long time ago with having fibrocystic breasts. They told me to give up all caffeine, and I did. By my next mammogram, they were gone,
Oh, okay.
you know, which was a year and a half to 2 years later. And that was a long
Correct.
time ago. I was in my 20s, my late 20s at the time, I think, when I had my first mammogram because the doctor detected, so no, actually it was right around the time I got married. So I was 23, 24. And then I didn't have to have one until later, you know, in my 30s. But after I had those first two, the one was, you know, showed the fibrocystic breast tissue, got off all caffeine. And then within a couple years, I think it was 2 years later, I had another one and it was clear.
Good.
And
That's great.
so haven't had any issues since then because I really don't drink caffeine.
Except for last week when you forgot.
Yeah.
So
Let's see. Using hair dye.
caffeine is a major irritant to fibroid cysts. A lot of guys, can you hear me?
Yep.
Yeah.
Okay. A lot of women don't realize that, obviously you do realize that it's in your coffee and your tea and such, but a lot of women don't realize how much chocolate has caffeine in it. So that's a go-to for women, you know, it's their happy little candy that they like. So that does cause pain in those fibroid cysts. It irritates them terribly.
All right. So those are the risk factors. Kathy, you want to talk about some prevention things that you found?
Well, like you said, being physically active is a good one, you know, to keep moving. It keeps everything in your body moving, you know, and it gets the lymph system too. I mean, it helps that as well, right, Sherry?
Yes, definitely.
Okay. And so then limit your alcohol intake. They say that's the general recommendation based on research on the effect of alcohol on breast cancer. So to limit that, maintain a healthy weight, goes along with the exercise and what you're eating. If you're a younger person, that if you breastfed your children, it's supposed to help in your later years too, to help with prevention. And you've already discussed the postmenopausal hormone therapy. So if you can, I don't know if bioidentical hormones are better for you than using or a natural type hormone, rather, if you really need them, rather than using the conventional hormones that people are placed on for that. So other ways to help prevent is, eating healthier, eating natural things. Your leafy green vegetables are supposed to be really good for you. What that does is, they contain different things like carotenoid antioxidants, beta carotene, lutein. I can't even pronounce the next one. Zeaxanthin. And so higher levels of that helps reduce your risks of getting or of having breast cancer. See, there's some other things in here as well. Eating citrus fruits are supposed to help as well because of the, citrus fruits are teeming with compounds that may protect against breast cancer, including folate, vitamin C, carotenoids, beta, okay, I can't even pronounce this one. Critox, well, okay, so anyways, beta carotene as well, plus flavonoid antioxidants like quercetin. Now, I was talking earlier with Sherry about when my husband went to that Cancer Institute in Arizona, and quercetin was one of the things that they prescribed for him. So is that related to a high level vitamin C or a stronger vitamin C quercetin? I'm not sure. But anyway, that was one of the things that was prescribed for him in preventing cancer to come back. Let's see, I'm just moving right along here. Fatty fish. So like salmon, sardines, mackerel are known to have very good health benefits. Their omega-3 fatty acid levels are what is helping us with that. Selenium and antioxidants, they offer some cancer protective effects as well. So, and with some of the food choices that we were given when we were in Arizona as well was eating berries, like blueberries, strawberries. They have a lower glycemic level. So what that relates to is the sugar level and how it's, how long it takes to get used in your body. It just doesn't do that big dump on you, I guess. It stretches it out more too. So all the berries are supposed to be really good for you as well. Something that's not going to spike your level of sugar up really high, because of course, sugar is cancer's favorite food. They also had him eating fermented foods, and that's another one to help. So like yogurt, kimchi, sauerkraut, they all contain probiotics and other nutrients that can help safeguard against breast cancer. Okay, how do you pronounce this? It's a type of vegetable, allium, A-L-L-I-U-M, allium, whatever, vegetable. But that's like garlic, onions, leeks. And so what these vegetables do, they boost an array of nutrients and flavonoid antioxidants in your body to help fight against breast cancer. Other, okay, so there's other fruits that you can also have, peaches, apples, pears, but the difference here is the glycemic index, number one. Number two is you want your fruits and vegetables to be on the clean, either the, on the clean 15 list. If they're not on the clean 15 list of the EWG, then go to organic vegetables. And regardless if they're organic or conventional, of course, you have to wash them and make sure they're clean before you put them in your mouth, only because of the pesticide residue and the handling of the products when they're, bringing them to market, I guess. Coniferous vegetables are good, including cauliflower, cabbage, broccoli, to help lower your risk of breast cancer and other cancers as well. And beans. Beans are supposed to be really good because they're loaded with fiber to get things moving through your system.
They're
They have a lot of
magical.
vitamins. Pardon me?
They're magical.
They are magical, the magical bean.
Magical fruit.
So they're loaded with fiber, vitamins, and minerals, and their high fiber content will also help in the, help to prevent against breast cancer. Herbs and spices like like parsley, rosemary, oregano, thyme, turmeric. Turmeric is very highly touted for so many different good things to reduce inflammation. Inflammation can also be the cause for the fire to feed those cancer cells to become active in your body. So turmeric is very good at reducing that. Curry, and all those have compounds that help protect against breast cancer. So oregano can boost the antioxidants in your system, and curcumin's another good one. They had my husband on curcumin, which does contain turmeric in it, right?
Mhm.
So they had him on that. He still takes that, and that has been, the curcumin and the compound. Oh, curcumin is in turmeric. I had him reversed. Sorry. It's the active compound in turmeric that also demonstrated significant anti-cancer properties. So that's pretty good. I mean, that's a lot of things but all these things that you found for prevention against breast cancer were all the things that they talked to us about when we were at the Alternative Cancer Institute.
And another thing that I don't know if you mentioned, I didn't hear it, but taking care of yourself emotionally and keeping your anxiety in check,
And your
because
stress levels.
that just can, you can kill yourself with worry and anxiety. And I saw it happen to my mom. I feel like she worried so much her whole life, even before she had cancer, but she was always worrying about this, worrying about that, and especially worrying about what people thought of her. I'm like, Mom, why do you care so much? These are complete strangers. But it just ate away at her all the time. And I feel like I have the worry gene, but I'm really good at suppressing it lately. I don't know, the more I know, and I mentioned this probably every show, that if you express gratitude for your life, for the good things that are happening, and you pray often and you give it to God, that can relieve that anxiety. So I will keep saying that, because I think not only is it a good spiritually, but it's good for your emotional health just to do that. My daughter has also inherited the worry gene, and hers is out of whack. And I worry about her about that, so I pray on that. But yeah, anxiety, your emotions, that can eat you away from the inside out.
Yeah, start using your lavender oils to help with that. I tell my patients to put a little bit on a cotton ball and stuff it in the little air conditioning vent of their car, because it gives you that nice aroma, especially people who have problems with anxiety with driving.
Right.
It helps with that and everything. So if you can keep those essential oils on hand and use those, it's a wonderful thing to help. It's a good benefit for you.
My daughter had to have a procedure yesterday, and she was nervous about it. So we had walked in, and I guess we were in the waiting room before she had to go in. And I said, you need some calm. And I handed her a roller of Valor, and we put it behind her ears, and, to help her calm down a little bit. And then she walked into the dressing room, and the nurse or the tech, I can't remember who she was, but she's like, what do you have on? And she said it in such a way that we thought we were going to get in trouble for her putting oils on her body. She goes, that smells so good, I need some. Like, it was just so I got my card, and I got the roller out and gave her some too. But yeah, it has a great effect. And maybe lavender isn't the one for people. You just have to figure out what does work, because our bodies are all different. And just like medications don't work for everybody, the same oils don't work for the same people. So, but yeah,
Right.
good on that one. Kathy, got anything else? It's okay if you don't.
I don't know. I want to hear Sherry speak and tell us something, and then maybe we can just kind of.
We have it, beamed into us. Get your mammogram, ladies. Get your mammogram, like starting at age 40 or 50, whatever it is. And it's, it's not without pain. I guess there are people who don't really feel that it's uncomfortable, but I don't know who those people are. And so mammography is a really good way to detect. However, there may be a better way, and Sherry is a thermographer. And you want to tell us what that is, because I'm sure there are people who have never heard of it and they don't even know what we're talking about.
Sure. So it's actually digital infrared thermal imaging. Your body gives off infrared heat wherever you have illness, disease, cancer, what have you. So this is a spice camera that can see that infrared heat. So when you have illness or disease, it generally starts out as inflammation in the body. And this camera can see that inflammation. So if you have clogged carotid arteries, if you have phlebitis, prediabetes, autoimmune disease, nerve impingements, degenerative disc disease, I mean, the list goes on and on and on, because most all diseases and illnesses start out with inflammation. So we're not actually looking for a specific illness, disease, or cancer in your body. We're looking for that bit of inflammation that starts out when you get that illness or disease. So that's why we have much earlier detection. What they don't tell you with a mammogram, one, there's 45 pounds of pressure that they're applying to the breast. A mammogram it uses radiation, which is not good for the body. We all know that. I'm not knocking a mammogram. I'm just telling you the difference. With a mammogram, it can only tell you that you have a lump. It can't identify the size or anything like that. They'll end up sending you for an ultrasound to see what size the lump is after that. So in other countries, they use thermograms and ultrasounds an awful lot, a lot more than mammograms. In our country, we seem to use mammograms more and thermography and ultrasounds less. The benefits of a thermogram is that we have earlier detection. When I told you that we can see the inflammation in the first year, we can see it when it's the size of a pinhead. That's very tiny, very small amounts. You could literally change your diet and reverse those effects of what's happening. Like with Kathleen's husband, when they changed his diet and got him on the path to reversing his cancer, that's what happened. So with thermography, we want to use thermography because I'm pro thermography and I know all the benefits of it. I would suggest using thermography first. And then if we see that there's an issue, use ultrasound to go ahead and monitor if that lump is growing larger and what's happening with that lump. With thermography, we can see if there's a blood supply going to it, if there's there's a lot more things that we can see that are going on with that lump. With the mammogram, they don't tell you that the mammogram can't actually see the tumor until between the 5th and the 8th year. That's when it's large enough to actually see it. So at that point in time, in the 8th year, you've got over 3 billion cancer cells in your body already. I'm not saying not to use a mammogram. I'm just telling you the difference between them. So with thermography, we can see it in the early stages. We can monitor it and see if you're changing your diet and it's progressively getting smaller, or if it's progressively getting larger. And that's what we want to do, is be able to monitor it. If a woman had a thermogram and we saw something happening, we would suggest that she goes and has an ultrasound right away. And And then depending on what her doctor says, they may even want her to have a mammogram, but the ultrasound usually, you want two forms of testing, always two forms of testing with any type of illness or disease anywhere in the body. So I would definitely choose to have myself to have a thermogram and then an ultrasound, because that ultrasound will monitor the size of it. You girls were talking earlier about essential oils and things like that. And there's essential oils that have cancer killing properties in them. And they, of course, you have your frankincense and your lavender and myrrh. So there's many essential oils that you can use as well to help, along with you changing your diet and things like that. So if a woman has breast cancer, it could be a good idea to rub frankincense, lavender, myrrh, what have you, one of the essential oils on there, so that you can work from the outside in as well as just internally eating food and things like that. Do you girls have any questions at all?
I was just listening to you about, first of all, you keep breaking up and you like, not breaking up, but you keep pausing. So we're waiting and it comes back. And maybe next week we can figure out something.
Oh, it's
the Wi-Fi, because you keep freezing, but that's okay. Anyway, as far as like, I would go with thermography first. And then what I read was that you follow it up with a mammogram if there's something there. But I like your suggestion of the ultrasound, but I wonder how many doctors would go for that. You know, like I went to my doctor and they're like, you need a mammogram. And I'm like, okay.
So
for thermography, and then sent them that result and didn't do anything else.
Okay, so some places do it a little bit backwards. They have a if you have a mammogram and they see something on there, then on the form that you sign for your mammogram at some institutions, I'm not saying everywhere does this, it also says if something is seen and detected, there's like a standing order, then they'll do an ultrasound on you as well, or schedule you for an ultrasound. That's not at every institution, every hospital, or every mammography center, but I know some of them have that on there.
correct. So the way that the insurance companies work, and that's generally the way that the doctors will inform you. They go by insurance because most people don't want to pay out of pocket. A lot of people don't know that they can pay out of pocket and have this other type of testing done, which is thermography. Unfortunately, it's not covered by insurance. It is self-pay. A lot of doctors don't know about thermography, unfortunately, even though it's been around for over 50 years. With the insurance, the way that it works with insurance is you have to get a mammogram first before they'll give you an ultrasound. There is a company called HerScan. It's herscan.com. So you could have a thermogram done, and then you could go to herscan.com and have a ultrasound done. It's all about you being the patient, and it's your body. What do you want to do with your body? I agree that you should listen to your doctor, but there are other alternatives that we can use to see what's going on inside of our body. If you don't know and you aren't open to learning about how to treat your body in different ways, and the different tests that are available out there, help yourself. But if you're open to learning different things, then you can request that you use different forms of testing. But the insurance does say you have to have a mammogram first, and then they'll allow you to go have an ultrasound, unfortunately.
That's a shame that it's backwards like that.
Because I had mentioned to Linda and Sherry earlier about a book that was suggested for us to get. It's called Cancer Free, Are You Sure? And it's by a nurse, Jenny Herbasic, that wrote the book. And she did a lot of studying on this and research, and she has all her things listed in here as to where she got a lot of her information from. But she herself had breast cancer, had the lump removed and, you know, did the conventional way of doing things, whether it was chemotherapy or radiation or whatever, because she was an RN. She worked with doctors and nurses, you know, at a regular hospital. So anyway, what happened was, you know, X amount of time later, you know, she did the, she went to a cancer support group. And in that cancer support group, she found out that a number of people, more than half the people in that cancer support group were second timers in there, meaning they had a second, you know, second occurrence of cancer. And she thought, now, wait a minute, most of them are here a second time. They told me my cancer was gone, I'm free of it and whatever. Well, so she did some more research on that, and she wrote a book. And in this book too, she talks about different conventional or different alternative things to fight cancer. And that depending on your chemotherapy and everything, okay, so you could either have the cancer cut out, you know, removed, you could poison it with chemotherapy, or it could be burned with radiation therapy. But what they don't tell you too is sometimes when they're doing the cutting or the biopsies and whatever else, is that they're creating another, this is from her book, that they're creating another route for that cancer, to those cells to escape and spread to your body, right? And you're not going to see those in x-rays, CTs, or MRIs or whatever, unless they're clumping together to form another tumor or a mass, right? So there are different tests that she suggests in here that you can have, blood tests, without going through, you know, an invasive procedure or a procedure that radiates you. She lists them in the book here. There's numerous of them, but they're not all the standard tests that your doctor would do. So you would basically really, you know, I mean, you can get the book, it's on Amazon, I think is where we purchased it from. But, you know, they have a different, you know, different types of testing depending on the type of cancer too that you have, and you want to see if it's reoccurring. Some of the tests you have to pay for because they're not going to be covered by your insurance, but they're supposedly very, very accurate. And there's numerous of them in here that I wouldn't be able to just like read through and tell you, you know, the many different tests. So, but, so I suggested her last name is HRBACEK, first name Jenny. And she is an RN, and it's called Cancer Free, Are You Sure? I mean, she also talked about, you know, like when they say you're cancer free, or, you know, different terms that they use now for, you know, your margins are clear around your, you know, where your tumor was cut out. That doesn't mean other cancer cells didn't escape into your body. So that's why you do want to stay on your healthy protocol of, you know, what you're eating, reduce your toxins, all those things. Linda and I had talked about rebounding, jumping on the trampoline. That helps with getting your lymph tissue, your lymph fluids moving in your body. Some of the things that, you know, those are some of the things that my husband, you know, went through his different types of protocols that he went through when he was in Arizona. He had IV vitamin C. He had B17, vitamin B17, which is truly Laetrile, which they use in other countries. And I don't know if you had heard about it in the late 60s, but we heard about a lot of Laetrile and people going to Mexico to have those treatments, which they do have a number of facilities in Mexico for cancer treatment, alternative cancer treatment. He also used an infrared sauna. He did the coffee ground enemas, which also help open up your, you know, relax and dilate your bile ducts and everything to help cleanse your liver. We did a green juice fast for 7 days to help clear things out of our body, as well as to, it kind of gave your immune system a little rest where it didn't have to worry about fighting so many other things and all that, you could cleanse easier and your liver could cleanse easier with the, and it was all green juices. So talking about the leafy greens that I said earlier, talked about earlier for helping prevention and helping if you do have cancer, to eat those leafy greens. He also had lymphatic drainage massages. Did an infrared sauna. I think I mentioned that. I had my little list and while I was going through things, I seem to have pushed it over someplace. And then for patients that actually had tumors, what they did was insulin potentiation therapy, which I was explaining earlier to Sherry, that it's a targeted type of chemotherapy. And only if you had an actual tumor did you have this done, not the patients that were there more for like the cleansing and the eating protocol like my husband was. But what they do is they hook up a bag of insulin and you're one-on-one with the nurse the whole time. And she's checking your sugar level as this insulin is being released. So it's not just opened up and she goes, oh, okay, that's it. You got this amount today, for this. They don't do it that way. They check your sugar every, I don't know if it's like 30 seconds. They're checking your sugar to see where your level is at because it'll make your sugar drop having IV insulin, right? Then once you get to a certain level of your sugar dropping down low, they shut the insulin off and they have a small, minute, probably like 1/10 the amount of chemo that you would get in a normal dose with a conventional way of going. And it's infused, the chemo is infused into the glucose bag because obviously cancer's favorite, favorite meal is sugar. So what this does is they inject the chemos in the glucose bag and then they open that up and run that. So now your cancer cells have starved because your sugar level is so low. So where's the first place? Where is that sugar going to go? It's going to be eaten up as quickly as possible by those cancer cells. So they're targeting those cancer cells to get that small amount of chemo into the cell to kill those cells. And they've had very good luck with it, just seeing people within the couple weeks that we were there and how fast these tumors were shrinking. And one gentleman came in there maybe 4 or 5 days before us and he had a large lump on his neck, a lymphoma tumor. And he started treatment. And then the day that we left, so he had been there for almost like 2.5 weeks. We were there for 2 weeks. You couldn't even tell. And when you run your finger over on
Amazing.
where it was, it's, like not even piece. You could barely feel it. So he was staying an extra week on to continue just to make sure that, it was gone. But just amazing results of what people told us and being right there with them daily, Monday through Friday, we were there with them and sometimes on a Saturday as well. But it was unbelievable. Sorry.
That's fine. Thank you for that. As luck would have it, I always believe in serendipity. It's so weird that this morning when I got on my email, I always have all kinds of things from health practitioners or health gurus and things. And today there was one from Chris Wark. And I don't know if you know Chris Wark. He is, his website is chrisbeatcancer.com. And he is doing a program called Square One, which is like teaching people what he did to beat cancer. But there was a free giveaway of this ebook. So the dynamic plant duo that destroys breast cancer cells. And so I downloaded it, but I actually did not read it yet. I think the two things might be garlic and lemon. I think those are the two things. So I will let you know more about this maybe next week. But the other thing that he has is this, I actually purchased this, but you can do it for free, is his this program where you can watch all of these little webinars. I'm going to share the screen if I can find my share button, because I move things around here. Share screen. Okay, here it is. So I don't know where that's supposed to be, someplace else. Can you see the square one?
Mhm.
Okay. So Square One Healing Cancer Coaching Program. There's like a little intro there, and then I've got all of these modules. Now, if you sign up for this, you can, it starts on Tuesday. And so on Tuesday, you'll see module 1. On Wednesday, you'd see module 2. And there, I don't believe there's any specific time frame. I think it's like whenever you sign on, it's available for 24 hours, and then you go on to the next one. And of course, they sell the whole program. I purchased it just because I want to have this, and I want to have time to go through it, not have to be glued to my computer every day. But I just thought I would share this. I'll share the link, and that you can get to it and take a look at it. And if you want to sign up for free, he beat cancer and did it in a natural way. And his family and friends all went, "Are you crazy? You're not going to get chemo. You're not going to get radiation." But he did the research, and he changed his diet, and he changed his lifestyle, and he beat it. So I just wanted to share that with you, because it was so weird that it came in my email this morning when we're talking about this. Also, I'll share real quickly for those who are local, Irene and Mary. Hi, Irene. We didn't get a chance to say good morning to you.
Morning, Irene.
Good morning.
The Sherry's website, see if I can pull that one up. I got the wrong one. Let's see. That's not it. I got so many websites open right here.
Thermographyforlife.org.
Yep. And I'll just share that with people so they can see that, what it looks like. And so you've got grants available too.
I do. Yes. So the first grant is you'll save up to $150 off depending on your income. That's through the United Breast Cancer Foundation. Through the United Breast Cancer Foundation, they also have the Holistic Cancer Treatment Grant. So if you have breast cancer and you want to treat it naturally, they do have a grant available for that as well. I have heard, I don't know for sure, I've heard that they will pay for all of your supplements for you. They'll drive you to and from doctor's appointments if needed. They do everything they possibly can to help you. So it's a wonderful program.
Great.
And of course, the United Breast Cancer Foundation supports thermography, along with many of the other ones. So I get women on Facebook and Instagram and things like that, that they knock thermography because they don't know about it. And it hasn't had a real, a lot of people don't know about it, which is unfortunate. There's a lot of doctors that don't know about it. But it is out there, it's real, it's available for you. We are worldwide, thermographers are worldwide. So just about wherever you are, you can get a thermogram done.
And while it's not uncomfortable physically, emotionally, you just got to get over it, because you do have to bear all. And but you do that in a mammogram anyway. So when I went,
Right.
Terry made me feel really comfortable. We bonded over several different things, but it was just like an old friend, doing a health check.
Right.
So.
Right. Yeah. Thermographers are quite used to seeing people and everything. So be comfortable. It's just something that we have to do to keep ourselves safe. So definitely have it done.
Okay, so last time I went for a thermography study, they had me put my hands in the ice basins, but they also had a newer one available. But the reason why they had me do that is because they wanted to correlate that one with my previous one. Then if everything was clear, then they were going to shift me over for next time to have, the other study done, which I haven't had done yet. So what is the difference between?
Sure. Yeah, so years ago, they used to have you put your hands in ice water. They don't do that any longer. Our cameras are much more sophisticated nowadays. And basically you disrobe on, so we can see the breast area. The reason we will have you disrobe and take your blouse and your bra off, or if you're having a full body scan done, you'll just be wearing your underwear. That's all you'll be wearing is just your panties. And the reason being is because if we were to give you a robe, that would hold the heat in. We can't see through clothing or anything like that. We have to actually, the camera detects the infrared heat coming off of
The skin, the body.
your body. So we don't give you a robe or anything like that. Basically, you disrobe in the bathroom, you come out and have a seat on the stool. We allow your body to adjust temperature because it does adjust temperature very quickly. And then we start taking images of your body. We can see actually on the camera and on the computer when your body actually adjusts temperatures and everything, because when you first sit down, your body will be warmer than after you wait a few minutes, and then your body adjusts the temperature and everything. And we start taking the images.
So is it like a
But
15 to 20-minute wait that?
So no, it's really the body regulates temperature very quickly. If you're in an air conditioned environment, where you're going to be when you come in for thermography, because the temperatures matter, you have to be cool. Your body will be pretty cool to begin with, because you've been in the room for, we go through your paperwork, we discuss some things first in the beginning and everything. And so your body's already adjusting temperature. It's just that when you take your blouse and your bra for a breast scan, it just takes a couple minutes to actually readjust. Once you've taken the clothing off, your body will get a little bit cooler. So we wait for that to happen. The breast scan takes about 15 minutes. For a full body scan takes about 25 to 30 minutes. We ask that you have all your paperwork already completed before you come in for your scan. But just to be clear, when we go over the different types of testing, again, with the thermogram, we have earlier detection. In the first year, we can see when it's the size of a pinhead, we can see the heat and the inflammation. And with the ultrasound, they can actually see the size and measure the size of the tumor. And with the mammogram, it basically just tells you that you have a tumor. So a lot of women already feel that they have a tumor. They go to their doctor, the doctor feels it as well. And then they send them in to have a mammogram, which
just confirms
that tumor is there. Like I said earlier, I would prefer that you do it the opposite way, do thermograms first, then ultrasound, and then mammogram, but it's all up to your doctor and the agreement that you have and you make with your doctor. But do remember, you own your body, nobody else does, and you are in charge of your body. And so a lot of times you'll go to the doctor's office and a doctor won't agree with something that you're wanting, but you can actually demand that you want things done in a certain way, or not have something done to your body, or not take a certain medication. People don't realize that they can say no, or they can ask for an alternative or something like that. We were always taught that the doctor knows best and everything, and the doctors know an awful lot, but you know your body better than anyone. But you should have a voice in saying if you want to have chemo or chemotherapy, radiation, if you want not. With a lot of prescriptions that doctors hand out, there are a whole long list of side effects, and you have to really take that into consideration too when you're prescribed a prescription, because those side effects can be sometimes worse actual illness or diseases that you have. So be very careful, research and studying for yourself.
Thank you so much, Sherry. I really appreciate you being on today, and you're going to come on next week too, I hope, and we'll continue this conversation. I want to put a plug in real quickly. I lost a good friend to breast cancer. She had it, she beat it, and then she got it again. And it not only came back into her breast, but I don't know if it went into the lymph system. It got into a place where it wasn't even operable if she could have it. It was like lodged. In any case, um, she fought a long and hard battle, and one of her good friends, who actually is more of a family, I mean, they're more like family. They're friends, but they're more like family, has a farm in upstate New York or Western New York, in Hilton, where I taught. And she's doing some things. They actually made a scholarship for Lisa. She was a fellow teacher in the Hilton School District, and they made a scholarship for her. So Ruth, who is one of the owners of Blodgett Family Farm in Hilton, New York, is doing fundraisers. So one of the things that she's doing, and this is for anybody who is watching this from that area, is they are selling pink pumpkins and pink mums. Let's see, here we go. And for everyone that is sold, $1 goes into the scholarship fund. And so I thought that was a great idea. So if anybody's watching from the Hilton area, go visit the Blodgett Family Farm. But they also have something called the Wreaths of Love, and every wreath comes with a donation to especially the breast cancer one. And I have that one, so I'm going to show you the breast cancer one on my door, and it's beautiful. So this is the breast cancer wreath. And so you can purchase those for $40 to $45 plus shipping. And I can't remember how much shipping is. I think it just depends on where you are. I also bought the patriotic one, so I have that one too. But every purchase comes with a donation to the scholarship fund. So, and that's supporting someone in the teaching field. But I just thought I would share that there are ways that you can get involved with this as well. So, and I just wanted to maybe dedicate this show today to Lisa and share a little bit about that. So,
May I just say
absolutely, Irene.
I've had breast cancer.
Mhm.
I went through some very tough chemo. I went through radiation. I fought hard. It was a tough battle, but I got through it.
Mhm.
This was 20 some years ago. So I've been cancer free, praise the Lord, for that amount of time. The side effects from the chemo are devastating to my body. I hear all these treatments, and I'm sure they work, but not everyone can have them. So be very careful with all the things you read and hear about. I wish we had a cure for breast cancer. We don't. So all these things that we're trying, God bless. I know what I'm going through now. So just because you have the tumor removed and they do all the stuff that they say they are going to do, I didn't walk away free of side effects.
Wow. I had no idea. Like, I figured once you're done, but so you're still having ramifications from the chemotherapy?
Yeah. My experience, I had Adriamycin cytoxin, which is a very potent treatment, and it almost killed me. It almost wiped me out. And today I'm in the oncologist office, the hematologist, every other week for blood work because of side effects of the chemo.
Wow.
So, I mean, I'm fine. I'm thank God I'm fine. And I've had mammograms, and I get one that it's, they inject a dye to pick up any kind of tumors in the breast. And they show up as a dark color or whatever, however they read the, this, I can't remember the name of the the things that they inject into the vein. But so far, so good.
Wow. I think next week, if you can come back, Irene, I would really like to encourage some other people to come on and you as well, to come tell some of your stories, you know, and as survivors of breast cancer, because I don't think we know enough about that. And I know for chemotherapy, I don't know if I would ever be desperate enough to go to chemotherapy because of the things that I've heard about them. And you're kind of telling me a little bit more there, that I definitely would, it depending on severity, of course, you never know what you're going to do until it actually hits you. But when my mom was here, she had cancer, and it was skin cancer, but it was starting to spread, and she had radiation, but we said, there's no way you can handle chemotherapy. That will just kill you, because it's poisoning your body. You have to be pretty darn healthy to use chemotherapy to combat any kind of cancer. So I hope that maybe you can come back and join us and tell us more of your story next week.
Okay.
Because I think people need to know your options, and know not only about prevention, but you know, what happens if, God forbid, you get breast cancer or any other kind of cancer. Hearing from survivors, I think, is a really powerful tool for us. So we are at 12:02. Anybody have any last thoughts for today? This has been really eye-opening for me, and thank you again, Sherry, for sharing your expertise in the matter.
I thank you for inviting me.
Thank you, Sherry. Looking forward to seeing you next
Sure.
week as well.
Okay. Thank you. Have a good day, ladies.
Thank you. You too. Thank you, everybody. We'll see you next week.
See you next week. Take care.
Bye-bye.
Thank you. Bye-bye.
Bye-bye.